Question 1. System analysis indicates that during a virtual medical appointment, a certified medical interpreter, CMI, is facilitating communication between a physician and a patient. The interpreter observes that the patient appears to be nodding, but due to the video quality and angle, the interpreter cannot discern the patient's facial expression or other subtle body language that might indicate agreement, confusion, or discomfort. The physician is proceeding with explaining a treatment plan, assuming the nodding signifies full comprehension. What is the most appropriate course of action for the CMI in this situation? Option A. Continue interpreting the physician's explanation without comment, assuming the patient's nodding indicates understanding and that any nonverbal cues are not critical to the immediate explanation. Option B. Inform the physician that the interpreter cannot accurately assess the patient's comprehension due to the limitations of virtual interpreting and suggest rescheduling the appointment for an in-person session. Option C. Focus solely on the verbal exchange and interpret the physician's words directly, without attempting to interpret or inquire about any nonverbal communication from the patient. Option D. Politely interrupt the physician and request that they pause to allow the interpreter to verbally confirm the patient's understanding, perhaps by asking the physician to describe any observed nonverbal cues if the patient appears to be reacting in a way that is not fully clear. The correct answer is D. Politely interrupt the physician and request that they pause to allow the interpreter to verbally confirm the patient's understanding, perhaps by asking the physician to describe any observed nonverbal cues if the patient appears to be reacting in a way that is not fully clear. Explanation. Scenario analysis. This scenario presents a significant challenge in virtual medical interpreting due to the inherent limitations of remote communication. The interpreter's inability to visually confirm the patient's nonverbal cues, such as subtle facial expressions, body language, or signs of distress, directly impacts their ability to provide comprehensive and accurate interpretation. This lack of full situational awareness can lead to misinterpretations, missed critical information, and a diminished patient experience, all of which have serious implications for patient safety and care quality. The professional challenge lies in mitigating these limitations while upholding the core principles of impartiality, accuracy, and confidentiality. Correct approach analysis. The correct approach prioritizes patient safety and the integrity of the interpretation by actively seeking to compensate for the limitations of virtual interpreting. This involves explicitly acknowledging the potential for missed nonverbal cues and proactively employing strategies to elicit clarification and confirm understanding. This aligns with the ethical guidelines for medical interpreters, which emphasize the interpreter's responsibility to ensure accurate and complete communication. By requesting the provider to verbally describe any observed nonverbal cues or to pause for confirmation, the interpreter is actively working to bridge the gap created by the virtual medium, thereby upholding the principle of fidelity in interpretation and ensuring the patient's needs are fully understood by the medical provider. This proactive stance is crucial for maintaining the quality of care in a remote setting. Incorrect approaches analysis. One incorrect approach involves proceeding with the interpretation without acknowledging the potential for missed nonverbal cues. This fails to address the inherent challenges of virtual interpreting and risks miscommunication or incomplete understanding. Ethically, this demonstrates a lack of diligence and a failure to ensure the accuracy and completeness of the interpretation, potentially violating the interpreter's duty of care. Another incorrect approach is to assume that the absence of verbal cues from the patient means there are no significant nonverbal cues to consider. This is a dangerous assumption in a medical context where nonverbal communication can be critical. It neglects the interpreter's responsibility to facilitate comprehensive understanding and could lead to overlooking vital patient information, thereby compromising patient safety and violating ethical standards of thoroughness. A further incorrect approach is to focus solely on the verbal exchange and ignore any potential visual cues that might be present on the screen, such as a patient wincing or looking confused. While virtual interpreting has limitations, interpreters are still expected to utilize all available sensory input to the best of their ability. Disregarding even limited visual information is a failure to provide the most complete interpretation possible and can lead to ethical breaches related to accuracy and completeness. Professional reasoning. Professionals should adopt a proactive and adaptive approach to virtual interpreting. This involves a pre-session assessment of the technological setup and potential communication barriers. During the session, interpreters must remain vigilant, actively seeking clarification, and employing strategies to compensate for the lack of full situational awareness. This includes verbally confirming understanding, requesting providers to describe nonverbal cues, and advocating for clear communication protocols. The decision-making process should always prioritize patient safety, accuracy, and ethical adherence, even when faced with technological limitations. Question 2. The efficiency study reveals that a busy hospital unit is experiencing delays in patient discharge due to lengthy explanations of post-operative care instructions. The attending physician, under pressure to improve patient flow, asks the medical interpreter to summarize the instructions for the patient, omitting some of the more complex details to save time. The interpreter is fluent in both English and the patient's primary language. What is the most ethically appropriate course of action for the medical interpreter? Option A. Interpret the instructions, but omit any mention of potential complications or side effects to avoid alarming the patient and causing further delays. Option B. Interpret the post-operative care instructions verbatim, ensuring the patient understands all details, and inform the physician that a complete interpretation is necessary for informed consent and patient safety. Option C. Provide a summarized version of the instructions as requested by the physician, focusing on the most critical points to expedite the discharge process. Option D. Politely decline to interpret the instructions and suggest the physician explain them directly to the patient in simpler terms. Correct answer is B. Interpret the post-operative care instructions verbatim, ensuring the patient understands all details, and inform the physician that a complete interpretation is necessary for informed consent and patient safety. Explanation. The efficiency study reveals a common challenge in healthcare settings: the pressure to expedite patient care, which can inadvertently create ethical dilemmas for medical interpreters. This scenario is professionally challenging because it pits the interpreter's duty to ensure accurate and complete communication against potential institutional pressures for speed. The interpreter must navigate this by upholding their core ethical principles, particularly confidentiality, impartiality, and accuracy, without compromising patient safety or well-being. The correct approach prioritizes the interpreter's ethical obligations and professional standards over perceived institutional efficiency. It recognizes that true efficiency in healthcare is achieved through clear, accurate communication that leads to correct diagnosis and treatment, not through shortcuts that risk misunderstanding. This approach upholds the interpreter's role as a neutral conduit of information, ensuring the patient fully understands their medical situation and can provide informed consent. It aligns with the core ethical principles of medical interpreting, which mandate impartiality, accuracy, and confidentiality, and implicitly support the patient's right to understand their care. An incorrect approach that involves interpreting selectively or omitting information to save time is a direct violation of the interpreter's ethical duty of accuracy and completeness. This can lead to misdiagnosis, inappropriate treatment, and serious patient harm, constituting a significant ethical and potentially legal failure. Another incorrect approach, such as directly advising the patient or physician on medical matters, oversteps the interpreter's role and violates the principle of impartiality. This can introduce bias, compromise the professional relationship between the patient and provider, and lead to incorrect medical decisions. Finally, an approach that involves discussing the patient's case with colleagues outside of the immediate care team, even if framed as seeking clarification on medical terms, breaches the fundamental ethical principle of confidentiality, unless explicitly authorized by the patient or legally mandated. Professionals facing similar situations should employ a decision-making framework that begins with identifying the core ethical principles at play. They should then assess the potential impact of each action on patient safety, autonomy, and the integrity of the communication process. When faced with conflicting demands, the interpreter must advocate for ethical practice, clearly communicate their professional boundaries and responsibilities to healthcare providers, and seek support from their interpreting agency or professional organizations if necessary. The ultimate goal is to facilitate effective, ethical, and patient-centered communication. Question 3. During the evaluation of a patient with limited English proficiency, a physician is explaining the details of a complex diagnostic procedure, including its potential risks, benefits, and alternatives. The interpreter, certified by the CMI, is tasked with facilitating this communication. The physician uses several technical terms and describes the procedure in a manner that assumes a certain level of medical understanding. The patient appears to be struggling to follow the explanation. Which of the following actions best upholds the interpreter's professional responsibilities and regulatory compliance in this situation? Option A. Explain the procedure in the patient's native language using common analogies and simplified explanations that deviate from the physician's precise terminology to ensure comprehension. Option B. Omit certain technical terms and descriptions that are deemed too complex for the patient to understand, focusing only on the most critical aspects of the procedure. Option C. Interpret the physician's explanation verbatim, including all technical terminology, and then offer to clarify any terms or concepts the patient finds unclear, prompting the patient to ask specific questions. Option D. Paraphrase the physician's explanation using simpler language and common analogies to ensure the patient grasps the overall concept of the procedure. Correct answer is C. Interpret the physician's explanation verbatim, including all technical terminology, and then offer to clarify any terms or concepts the patient finds unclear, prompting the patient to ask specific questions. Explanation. The scenario presents a common challenge for medical interpreters, ensuring accurate and culturally sensitive communication of complex medical information, specifically diagnostic and procedural terminology, within the strict confines of U.S. federal regulations governing healthcare access and interpreter qualifications. The challenge lies in the potential for misinterpretation of nuanced medical terms, which can lead to significant patient harm, misdiagnosis, or inappropriate treatment. Professional interpreters must navigate not only linguistic accuracy, but also the ethical imperative to convey meaning faithfully, respecting patient autonomy and privacy. The correct approach prioritizes direct, verbatim interpretation of the physician's explanation of a complex diagnostic procedure, including its risks and benefits, while also offering to clarify any terms the patient finds unclear. This aligns with the interpreter's role as a conduit of information, ensuring the patient receives the same information as a proficient English speaker. This approach is best professional practice because it upholds the interpreter's ethical obligation to accuracy and impartiality, as mandated by national standards for medical interpreters, and implicitly supported by federal regulations like Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on national origin and requires effective communication for individuals with limited English proficiency. The Certified Medical Interpreter, CMI, credential signifies adherence to these standards, emphasizing the interpreter's responsibility to convey information without omission, addition, or alteration. An incorrect approach would involve paraphrasing the physician's explanation to simplify it. This is professionally unacceptable because it introduces the interpreter's own interpretation and potential biases, deviating from the verbatim rendition of the medical information. This violates the core principle of accurate interpretation and could lead to a misunderstanding of the procedure's complexities, risks, or benefits, potentially impacting the patient's informed consent. Such an action could also be seen as a violation of the interpreter's professional code of ethics, which stresses fidelity to the source message. Another incorrect approach would be to omit certain technical terms deemed too difficult for the patient to understand. This is a serious ethical and regulatory failure. Federal regulations and professional standards require that all information be conveyed, allowing the patient to decide what is understandable or requires further clarification. Omitting information undermines patient autonomy and the principle of informed consent. It also implies the interpreter is making a judgment about what the patient needs to know, which is outside the interpreter's scope of practice. Finally, an incorrect approach would be to explain the procedure in the patient's native language using common analogies or simplified explanations that deviate from the physician's precise terminology. While well-intentioned, this practice can lead to inaccuracies and misrepresentations of the medical information. Analogies, though helpful in some contexts, can oversimplify or mischaracterize complex medical concepts, potentially leading to a false sense of understanding or misunderstanding of critical details. The interpreter's role is to facilitate understanding of the physician's communication, not to re-educate or simplify to the point of inaccuracy. Question 4. Benchmark analysis indicates that during a patient encounter, a physician uses the term dyspnea to describe a patient's symptom. The patient speaks a language for which the interpreter is certified. Which of the following represents the most appropriate action for the medical interpreter? Option A. Simplify the term to a general feeling of discomfort without specifying the respiratory nature of the symptom. Option B. Translate dyspnea into the patient's language using a term that accurately conveys the sensation of shortness of breath or difficulty breathing. Option C. Offer a potential diagnosis or interpretation of the symptom, such as suggesting the patient might have asthma. Option D. Provide a literal, word-for-word translation of dyspnea that may not be understood by the patient in the context of their breathing. The correct answer is B. Translate dyspnea into the patient's language using a term that accurately conveys the sensation of shortness of breath or difficulty breathing. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of complex medical terminology, which can directly impact patient care and safety. The interpreter's role is to bridge communication gaps accurately, ensuring that both the healthcare provider and the patient understand critical information. Failure to do so can lead to misdiagnosis, incorrect treatment, or adverse patient outcomes. The interpreter must possess not only linguistic proficiency, but also a robust understanding of medical concepts and terminology relevant to the specific encounter. Correct approach analysis. The correct approach involves accurately translating the medical term dyspnea into the patient's language, using a term that conveys the sensation of shortness of breath or difficulty breathing. This aligns with the core ethical and professional responsibilities of a medical interpreter, which include ensuring accurate and complete communication. The CMI certification itself signifies a commitment to upholding these standards, which are implicitly guided by professional codes of conduct emphasizing accuracy, impartiality, and patient advocacy through clear communication. The regulatory framework for medical interpreters, while not explicitly detailed here, universally mandates precision in conveying medical information. Incorrect approaches analysis. One incorrect approach would be to provide a literal, word-for-word translation of dyspnea that does not convey the intended meaning of difficulty breathing. This fails to meet the fundamental requirement of accurate communication, potentially confusing the patient or leading them to underestimate the severity of their symptom. This is a failure of professional duty and can be seen as a breach of the interpreter's obligation to facilitate understanding. Another incorrect approach would be to simplify the term to a very general feeling of discomfort without specifying the respiratory nature of the symptom. This lacks the necessary specificity required in a medical context. While seemingly less harmful than a completely inaccurate translation, it still omits crucial diagnostic information for the healthcare provider and can lead to a less targeted treatment plan. This demonstrates a lack of understanding of the nuances of medical terminology and its importance in diagnosis. A third incorrect approach would be to offer a diagnosis or interpretation of the symptom rather than a direct translation. For example, suggesting the patient might have asthma. This oversteps the interpreter's role, which is to facilitate communication, not to provide medical advice or interpretation. This is a significant ethical violation, potentially leading to patient anxiety or misdirection, and is strictly prohibited by professional standards for medical interpreters. Professional reasoning. When faced with complex medical terminology, a professional medical interpreter should first access their knowledge base for the most accurate and contextually appropriate equivalent in the target language. If uncertainty exists, the interpreter should seek clarification from the healthcare provider regarding the specific meaning or context of the term before attempting to convey it to the patient. The priority is always fidelity to the source message, ensuring that the patient receives the same information as the provider, albeit in their language. This systematic approach, prioritizing accuracy and professional boundaries, is crucial for effective and ethical medical interpretation. Question 5. Quality control measures reveal that during a consultation between a physician and a patient with limited English proficiency, the interpreter, upon noticing the patient appearing hesitant and looking to their adult child for cues after receiving a diagnosis, proceeds to explain the medical implications of the diagnosis in detail to the patient's child, assuming the child will relay the information appropriately. What is the most ethically appropriate action for the interpreter to take in this situation? Option A. Focus solely on translating the physician's words verbatim to the patient, and then turn to the patient's child to ensure they have understood the information being conveyed. Option B. Continue to interpret the physician's explanation directly to the patient, and then privately ask the patient if they understood the information, without involving the child in this specific check. Option C. Directly advise the patient on the best course of action based on the diagnosis, explaining the pros and cons of different treatment options as they understand them. Option D. Politely interrupt the flow of communication and ask the healthcare provider to pause. Then discreetly inquire if there are any cultural considerations or specific ways the patient prefers to receive difficult news, and then facilitate a conversation between the provider and patient to ensure comprehension. The correct answer is D. Politely interrupt the flow of communication and ask the healthcare provider to pause. Then discreetly inquire if there are any cultural considerations or specific ways the patient prefers to receive difficult news, and then facilitate a conversation between the provider and patient to ensure comprehension. Explanation. This scenario presents a professional challenge rooted in the inherent complexities of cross-cultural communication within a healthcare setting. The core difficulty lies in balancing the patient's right to understand their medical situation with the interpreter's ethical obligation to convey information accurately and impartially, while also respecting cultural nuances that might influence how information is received or expressed. The interpreter must navigate potential differences in communication styles, beliefs about health and illness, and family dynamics that could impact the patient's decision-making process. Careful judgment is required to ensure that the interpretation facilitates effective communication without imposing personal biases or misinterpreting culturally influenced behaviors. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent, which are fundamental ethical principles in healthcare. By seeking clarification from the healthcare provider regarding the patient's understanding and cultural context, the interpreter acts as a facilitator of communication, ensuring that the patient receives the necessary information in a way that is comprehensible and culturally sensitive. This aligns with the CMI Code of Professional Ethics, which emphasizes accuracy, impartiality, and cultural competence. Specifically, it upholds the principle of conveying the full meaning of the message, including any cultural implications that might affect comprehension or decision-making, and promotes a collaborative approach with the healthcare team to ensure optimal patient care. An incorrect approach that involves directly advising the patient on their treatment options, even with good intentions, represents a significant ethical failure. This violates the principle of impartiality and oversteps the interpreter's role, potentially undermining the physician-patient relationship and the patient's autonomy. It introduces personal bias into the communication process and could lead to the patient making decisions based on the interpreter's personal opinions rather than their own informed judgment. This also fails to respect the professional boundaries established for healthcare providers and interpreters. Another incorrect approach, which is to simply translate the words spoken by the provider without attempting to ascertain the patient's comprehension or cultural context, is also professionally unacceptable. It adheres to a literal interpretation. It neglects the crucial element of ensuring actual understanding. Cultural differences can significantly impact how medical information is processed, and a purely literal translation may miss vital nuances, leading to misinterpretation and potentially harmful outcomes. This approach fails to meet the ethical standard of facilitating effective communication and ensuring the patient's comprehension. A third incorrect approach, which is to defer all communication to the family members present, even if the patient is capable of understanding, is ethically problematic. While family involvement can be important, the primary responsibility for communicating with the patient rests with the healthcare provider and the interpreter. Relying solely on family can inadvertently exclude the patient from their own healthcare decisions, especially if family dynamics or cultural norms dictate that certain information should not be directly shared with the patient. This can infringe upon the patient's right to privacy and self-determination. The professional decision-making process for similar situations should involve a continuous assessment of the communication dynamic. Interpreters should first strive for accurate and complete interpretation. If there are indications of misunderstanding, cultural barriers, or potential for misinterpretation, the interpreter should ethically and professionally seek clarification from the healthcare provider. This might involve asking the provider to rephrase, use simpler language, or provide additional context. The interpreter should also be attuned to nonverbal cues and cultural communication styles, and when appropriate, discreetly inform the provider of potential cultural considerations that might affect the patient's understanding or response. The ultimate goal is to facilitate a shared understanding between the patient and the healthcare provider, ensuring the patient's well-being and autonomy. Question 6. Regulatory review indicates that certified medical interpreters, CMI, must accurately convey complex medical terminology. When encountering the term cardiomyopathy, which of the following approaches best demonstrates the interpreter's understanding of the term's structure to ensure precise communication? Option A. Identifying the root word cardio as relating to the heart and inferring the rest of the meaning from context. Option B. Guessing the meaning based on the sound of the word and its similarity to other known medical terms. Option C. Recognizing cardio as the root for heart, myo as the root for muscle, and pathy as a disease, thus understanding the term as a disease of the heart muscle. Option D. Asking the physician to explain the term to the patient directly, as it is a complex medical condition. Correct answer is A. Identifying the root word cardio as relating to the heart and inferring the rest of the meaning from context. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified medical interpreter, CMI, due to the inherent complexity of medical terminology and the potential for misinterpretation, which can have serious consequences for patient care. The interpreter must accurately decipher the meaning of a medical term by breaking it down into its constituent parts, prefix, root, suffix, to ensure precise communication. Failure to do so could lead to a misunderstanding of the patient's condition, treatment, or prognosis, directly impacting patient safety and the interpreter's adherence to professional standards. Correct approach analysis. The correct approach involves a systematic deconstruction of the medical term. By identifying the prefix e.g., hyper, the root word e.g., tension, and the suffix e.g., itis, the interpreter can deduce the meaning of the entire term. This analytical process is crucial for accurate interpretation, aligning with the CMI's ethical obligation to provide faithful and complete renditions. This method ensures that the interpreter understands the underlying medical concept before attempting to convey it to the patient or provider, thereby upholding the principle of accuracy and avoiding miscommunication, which is a cornerstone of professional medical interpreting as outlined in CMI guidelines. Incorrect approaches analysis. One incorrect approach is to rely solely on a general understanding of common medical terms without dissecting the specific components. This can lead to oversimplification or misapplication of meaning, especially with less common or nuanced terminology. This failure violates the CMI's duty to provide accurate and complete interpretation, potentially leading to patient harm. Another incorrect approach is to guess the meaning based on a partial understanding of one component, such as only recognizing the root word. This bypasses the critical role of prefixes and suffixes in modifying the root's meaning, leading to an incomplete or inaccurate interpretation. This directly contravenes the CMI's responsibility to interpret the full meaning of the medical term, risking miscommunication and compromising patient safety. A further incorrect approach is to defer to the healthcare provider for the definition of every complex term. While collaboration is important, the CMI's role is to interpret, not to be a passive conduit. This reliance on others for definitions undermines the interpreter's professional autonomy and expertise, and can lead to delays in communication or a loss of nuance that the interpreter might otherwise capture through linguistic analysis. This approach fails to meet the CMI's obligation to independently understand and convey medical information accurately. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy and ethical adherence. This involves a commitment to continuous learning and the development of strong analytical skills for deconstructing medical terminology. When encountering an unfamiliar term, the interpreter should first attempt to break it down into its known components. If ambiguity persists, consulting a reliable medical dictionary or a trusted colleague, while maintaining the integrity of the interpretation process, is a secondary step. The primary responsibility remains with the interpreter to understand and accurately convey the meaning, ensuring patient safety and upholding professional standards. Question 7. Market research demonstrates that cultural beliefs can significantly influence a patient's understanding of illness, treatment adherence, and overall health outcomes. In a clinical setting, a certified medical interpreter, CMI, is facilitating a conversation between a physician and a patient regarding a recommended surgical procedure. The patient expresses reluctance, stating that their deeply held religious beliefs prohibit them from undergoing any invasive medical interventions, as they believe their healing comes solely from divine intervention. The physician has explained the medical necessity and potential risks of delaying the surgery, What is the most appropriate course of action for the CMI in this situation? Option A. Translate the physician's explanation of the medical necessity and risks of the surgery verbatim, without further inquiry or acknowledgement of the patient's stated religious beliefs, assuming the patient will process the information independently. Option B. Advise the patient that while their beliefs are respected, delaying the surgery could have severe consequences for their health, and encourage them to reconsider their religious objections for the sake of their well-being. Option C. Suggest to the patient that they might find a different physician who is more understanding of their religious beliefs, as this current physician seems unwilling to accommodate their spiritual needs. Option D. Politely acknowledge the patient's beliefs, and then accurately and neutrally convey the physician's explanation of the medical necessity, risks, and benefits of the surgery, ensuring the patient understands the information in their own terms, and offer to facilitate further questions to the physician. The correct answer is D. Politely acknowledge the patient's beliefs, and then accurately and neutrally convey the physician's explanation of the medical necessity, risks, and benefits of the surgery, ensuring the patient understands the information in their own terms, and offer to facilitate further questions to the physician. Explanation. This scenario presents a professional challenge because it requires the medical interpreter to navigate a situation where a patient's deeply held cultural beliefs directly conflict with recommended medical treatment, potentially impacting their health outcomes. The interpreter must balance the imperative to facilitate accurate communication with the ethical obligation to respect patient autonomy and avoid imposing their own or the medical provider's cultural norms. Careful judgment is required to ensure the patient understands the medical information fully, enabling them to make an informed decision without inadvertently causing distress or undermining trust. The correct approach represents best professional practice because it prioritizes patient-centered care and upholds the interpreter's role as a neutral conduit of information. By actively seeking to understand the patient's cultural perspective and then clearly and accurately conveying the medical information, including potential risks and benefits, the interpreter empowers the patient. This aligns with ethical codes of conduct for medical interpreters, which emphasize impartiality, accuracy, confidentiality, and cultural competence. Specifically, it adheres to the principle of facilitating informed consent by ensuring the patient comprehends the medical situation in a way that respects their worldview. An incorrect approach that involves directly advising the patient to disregard their cultural beliefs is a significant ethical and regulatory failure. This constitutes a breach of impartiality and neutrality, moving beyond the interpreter's defined role into that of a medical advisor or advocate for a specific treatment path. It risks alienating the patient, damaging the therapeutic relationship, and potentially leading to noncompliance with treatment due to mistrust. Furthermore, it can be seen as cultural insensitivity, violating the core tenet of cultural competence expected of certified medical interpreters. Another incorrect approach, which is to simply translate the medical information without attempting to understand or acknowledge the cultural context, fails to fully meet the interpreter's obligation to facilitate effective communication. While accurate in literal translation, it may not convey the full meaning or implications to the patient, especially when cultural beliefs shape their understanding of health and illness. This can lead to misunderstandings and ultimately impact health outcomes, as the patient may not grasp the rationale behind the medical recommendations in a way that resonates with their own framework. This approach neglects the crucial aspect of cultural mediation inherent in the role of a medical interpreter. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and understand the patient's concerns and cultural beliefs. Second, accurately and neutrally convey the medical provider's information, ensuring clarity and comprehension. Third, if cultural beliefs appear to be a barrier to understanding or acceptance, gently inquire if the patient would like the interpreter to help clarify how the medical information relates to their beliefs, or if they would like to express their concerns to the provider. Fourth, always maintain impartiality and avoid offering personal opinions or advice. Finally, document any significant communication challenges or cultural considerations as per facility policy. Question 8. Market research demonstrates a growing demand for medical interpreters proficient in highly specialized fields. A certified medical interpreter, CMI, is assigned to a patient consultation with a cardiologist. During the session, The cardiologist uses several technical terms specific to cardiac electrophysiology, such as ectopic beats, atrioventricular nodal reentrant tachycardia, and pulmonary vein isolation. Which of the following approaches best reflects the professional responsibilities and ethical obligations of the CMI in this situation? Option A. Actively researching and utilizing precise, established terminology for cardiac electrophysiology, potentially consulting a medical glossary or seeking clarification from the cardiologist if absolutely necessary and appropriate within the flow of the session. Option B. Guessing at the meaning of the terms based on their phonetic similarity to common words and improvising translations to keep the conversation moving. Option C. Relying on general medical knowledge and providing the closest literal translation of the terms, assuming the patient will understand the gist. Option D. Translating the terms using common English equivalents that describe general heart rhythm disturbances, without specific attention to the precise electrophysiological diagnosis being discussed. The correct answer is C. Relying on general medical knowledge and providing the closest literal translation of the terms, assuming the patient will understand the gist. Explanation. This scenario presents a professional challenge due to the nuanced and specialized nature of medical terminology across different subspecialties. A medical interpreter must possess not only general language proficiency, but also a deep understanding of the specific lexicon used within various medical fields. Misinterpreting or failing to accurately convey highly technical terms can lead to significant misunderstandings, potentially impacting patient care, diagnosis, and treatment plans. The Certified Medical Interpreter, CMI, credential signifies a commitment to accuracy and ethical practice, which includes maintaining linguistic and cultural competence across a broad spectrum of medical disciplines. The correct approach represents best professional practice because it directly addresses the core competency required of a CMI: accurate and nuanced interpretation across medical specialties. By actively seeking to understand and utilize the precise terminology of cardiology, the interpreter demonstrates a commitment to linguistic accuracy and patient safety, aligning with the ethical obligations of the profession to provide faithful and complete interpretations. This proactive engagement with specialized vocabulary is essential for upholding the integrity of communication between healthcare providers and patients, a fundamental tenet of medical interpreting. An incorrect approach that relies on general medical knowledge without specific subspecialty vocabulary would be professionally unacceptable. This failure stems from a lack of linguistic precision, which can lead to miscommunication. For instance, confusing a general term for a heart condition with a specific diagnosis within cardiology could have serious consequences for the patient. This violates the ethical principle of accuracy and fidelity in interpretation. Another incorrect approach that involves guessing or improvising terminology is a direct contravention of professional standards. Medical interpreting demands certainty and precision. Guessing introduces a high risk of error and can undermine the trust between the patient and the healthcare provider. This constitutes a significant ethical lapse, as it prioritizes expediency over accuracy and patient well-being. Furthermore, an approach that assumes a direct, literal translation without considering the idiomatic usage or specific meaning within the medical subspecialty is also flawed. Medical language often employs specialized phrasing that does not translate directly. Failing to recognize and adapt to these nuances results in an interpretation that, while grammatically correct, may be medically inaccurate or misleading. This demonstrates a deficiency in cultural and linguistic competence specific to the medical context. The professional decision-making process for similar situations should involve a commitment to continuous learning and a proactive approach to acquiring specialized knowledge. When encountering unfamiliar medical terminology or subspecialties, a professional interpreter should 1. Acknowledge the gap in knowledge. 2. Utilize reliable resources such as medical dictionaries, glossaries, and reputable online medical databases to research and verify terminology. 3. Consult with healthcare providers for clarification when appropriate and feasible, ensuring that such consultations do not compromise patient confidentiality or the flow of communication. 4. Maintain a personal glossary of specialized terms encountered. 5. Recognize the limitations of one's expertise and, if necessary, advocate for the involvement of a more specialized interpreter. This systematic approach ensures accuracy, upholds ethical standards, and prioritizes patient safety. Question 9. Implementation of site translation of a complex, multi-page patient discharge summary by a certified medical interpreter (CMI) during a critical patient handoff scenario. The physician hands the interpreter the document and states, "I need this translated for the patient and their family immediately. They are waiting in the room." The interpreter has not seen the document before. Option A. Offer to summarize the key points of the discharge summary to expedite the process. Option B. Inform the physician that site translation of lengthy documents is outside the scope of their immediate duties and suggest they provide a verbal summary instead. Option C. Immediately begin translating the document verbatim, prioritizing speed over thoroughness. Option D. Request a brief moment to review the document to ensure accuracy before beginning the translation. The correct answer is D. Request a brief moment to review the document to ensure accuracy before beginning the translation. Explanation. This scenario presents a professional challenge due to the inherent tension between the interpreter's duty to facilitate accurate communication and the potential for misinterpretation or omission when performing site translation under pressure. The interpreter must balance the need for speed with the absolute requirement for fidelity and accuracy, especially in a medical context where patient safety is paramount. Careful judgment is required to assess the complexity of the document, the urgency of the situation, and the interpreter's own proficiency in both languages and the subject matter. The correct approach represents best professional practice because it prioritizes patient safety and accurate medical information exchange. By requesting a moment to review and prepare, the interpreter demonstrates a commitment to accuracy and ethical practice. This aligns with the core principles of medical interpreting, which emphasize fidelity, impartiality, and confidentiality. Specifically, it upholds the interpreter's responsibility to convey the source message accurately and completely, without altering, omitting, or adding to the message. This proactive step ensures that the translated information is as precise as possible, minimizing the risk of medical errors stemming from miscommunication. An incorrect approach that involves immediately attempting to translate a complex medical document without preparation is professionally unacceptable. This fails to meet the standard of accuracy required in medical settings. It risks omitting critical information, misinterpreting technical terms, or conveying a distorted meaning, all of which can have severe consequences for patient care. Such an action violates the ethical obligation to provide accurate and complete interpretation, potentially leading to patient harm and a breach of professional standards. Another incorrect approach, such as summarizing or paraphrasing the document instead of providing a direct translation, is also professionally unacceptable. Medical interpreting requires verbatim rendition of the source text to ensure that all nuances and specific details are conveyed. Summarization can lead to the loss of crucial information or the introduction of the interpreter's own interpretation, compromising the integrity of the communication. This deviates from the principle of fidelity and can mislead healthcare providers and patients. A further incorrect approach, such as refusing to site translate altogether without a valid reason or offering to translate only parts of the document, is also problematic. While interpreters have the right to decline assignments beyond their competence, a blanket refusal or partial translation without clear justification can hinder effective communication. If site translation is a necessary skill for the interpreter's role, and the document is within their linguistic and subject matter capabilities, a refusal without adequate explanation can be seen as a failure to fulfill professional duties. The ethical approach involves assessing the situation and, if necessary, communicating limitations and seeking appropriate support or alternative solutions. The professional decision-making process for similar situations should involve a rapid assessment of the document's complexity, the urgency of the request, and the interpreter's own capabilities. If the document appears complex or the situation is highly time-sensitive, interpreters should ethically communicate their need for a brief moment to prepare to ensure accuracy. This communication should be professional and brief, explaining that a moment of preparation will ensure the highest quality of translation. If the document is clearly beyond the interpreter's expertise or linguistic proficiency, they should ethically state this limitation and offer to find a more qualified interpreter or suggest alternative methods of communication if appropriate. The overarching principle is to prioritize patient safety and accurate information exchange at all times. Question 10. Market research demonstrates that patients from certain cultural backgrounds may express concerns or disagreements indirectly, using hesitant language and nonverbal cues rather than direct confrontation. A physician is explaining a complex treatment plan to a patient who, while nodding, uses phrases like, "It is interesting," and avoids direct eye contact when discussing potential side effects. Interpreter observes these subtle cues and recognizes a potential disconnect between the patient's outward agreement and their internal reservations. What is the most appropriate course of action for the certified medical interpreter in this situation? Option A. Inform the physician that the patient is clearly not understanding the treatment plan and recommend they simplify their explanation. Option B. Directly ask the patient, "Are you disagreeing with the treatment plan?" Option C. Politely and discreetly ask the physician if they would like the interpreter to explore the patient's understanding further, given the patient's communication style, or if they would prefer to proceed. Option D. Translate the patient's exact words, "It is interesting," and assume the patient understands and agrees with the plan. The correct answer is C. Politely and discreetly ask the physician if they would like the interpreter to explore the patient's understanding further, given the patient's communication style, or if they would prefer to proceed. Explanation. This scenario is professionally challenging because it requires the medical interpreter to navigate a significant cultural difference in communication styles, specifically regarding directness and the expression of disagreement. Within a high-stakes medical context, the interpreter's primary ethical and professional obligation is to ensure accurate and complete communication while maintaining impartiality and respecting patient autonomy. Misinterpreting or failing to convey the nuances of the patient's communication style could lead to misunderstandings about their condition, treatment preferences, or adherence to medical advice, potentially impacting their health outcomes. The correct approach represents best professional practice because it prioritizes accurate and culturally sensitive interpretation. By carefully observing the patient's nonverbal cues and indirect language, and then seeking clarification from the physician in a culturally appropriate manner, the interpreter facilitates a more complete understanding for both parties. This aligns with the core principles of medical interpreting, which include facilitating accurate information exchange, respecting cultural differences, and ensuring patient comprehension, as outlined in professional codes of ethics and best practice guidelines for medical interpreters, which emphasize the interpreter's role as a conduit for meaning, not just words. An incorrect approach that involves directly translating the patient's hesitant phrasing without seeking clarification from the physician fails to convey the underlying concern or potential disagreement. This can lead the physician to believe the patient fully understands and agrees, when in reality, the patient may have reservations or be hesitant to express them directly due to cultural norms. This failure to convey the full spectrum of meaning constitutes a breach of accurate interpretation and can undermine informed consent. Another incorrect approach, such as directly asking the patient if they disagree, might be perceived as confrontational or culturally insensitive, potentially alienating the patient and shutting down further communication. This violates the principle of maintaining neutrality and respecting the patient's communication style. A third incorrect approach, such as assuming the patient's silence or indirectness means agreement, is a dangerous misinterpretation. This can lead to critical medical decisions being made without the patient's full understanding or consent, posing a significant ethical and professional risk. It demonstrates a lack of cultural competence and a failure to actively facilitate communication. The professional decision-making process for similar situations involves a multi-step approach. First, actively listen to both verbal and nonverbal cues, paying close attention to cultural communication patterns. Second, identify potential discrepancies or areas of ambiguity. Third, if clarification is needed, seek it in a culturally appropriate manner, either by gently probing the patient for more information or by discreetly seeking clarification from the provider about the patient's communication style. Fourth, always prioritize accuracy and completeness of message transfer, ensuring that the intended meaning, not just the literal words, is conveyed. Finally, remain neutral and avoid imposing personal interpretations or judgments. Question 11. The control framework reveals that a patient, recently arrived in the United States and with limited English proficiency, is seeking to understand their options for managing a chronic condition. They have expressed confusion about how to access ongoing medical care, including specialist appointments and prescription refills, given the diverse nature of healthcare providers and insurance plans. Which approach best equips a certified medical interpreter, CMI, to assist this patient in navigating the U.S. healthcare delivery system. Option A. Assuming the patient has access to employer-sponsored health insurance and explaining care options based on that assumption. Option B. Focusing solely on the immediate medical needs presented by the patient's chronic condition and relaying information about available treatments without delving into the complexities of the healthcare system. Option C. Prioritizing the healthcare delivery system of the primary medical provider the patient is currently interacting with, regardless of the patient's broader needs or potential access to other systems. Option D. A comprehensive understanding of the U.S. healthcare delivery system, including public programs like Medicare and Medicaid, private insurance models, and the role of community health centers, enabling the interpreter to explain available options and guide the patient toward appropriate resources. Correct answer is D. A comprehensive understanding of the U.S. healthcare delivery system, including public programs like Medicare and Medicaid, private insurance models, and the role of community health centers, enabling the interpreter to explain available options and guide the patient toward appropriate resources. Explanation. This scenario presents a professional challenge due to the inherent complexities of navigating different healthcare delivery systems and the critical role of the medical interpreter in ensuring accurate and equitable communication across these systems. The interpreter must possess a nuanced understanding of how healthcare is organized, funded, and accessed within the specified jurisdiction to effectively bridge communication gaps and advocate for patient understanding. Careful judgment is required to identify the most appropriate system for a patient's needs, considering factors like insurance coverage, available services, and patient preferences, all while adhering to ethical principles of impartiality and accuracy. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the U.S. healthcare delivery system, encompassing its various public and private components, and how these systems interact. This allows the interpreter to accurately guide patients towards appropriate resources, explain complex insurance or eligibility requirements, and facilitate informed decision-making. This aligns with the CMI's ethical code, which mandates providing accurate and complete interpretation and implicitly requires understanding the context of the healthcare system to achieve this. Furthermore, it supports the principle of patient advocacy by empowering patients with knowledge about their healthcare options. An incorrect approach that focuses solely on the patient's immediate medical need without considering the broader healthcare system fails to provide comprehensive support. This can lead to misdirected care, unnecessary costs, and patient dissatisfaction, violating the interpreter's duty to facilitate effective communication and access to care. Another incorrect approach that assumes all patients have access to the same level of care or the same insurance coverage ignores the significant disparities within the U.S. system, potentially leading to misinterpretations of eligibility and service availability. This can result in ethical breaches related to fairness and equity. An approach that prioritizes the provider's system without considering the patient's perspective or the most suitable system for their circumstances is also professionally unacceptable, as it undermines the interpreter's role as a neutral facilitator and advocate for patient understanding. The professional decision-making process for similar situations should involve a systematic assessment of the patient's situation, including their medical condition, insurance status, and stated preferences. The interpreter should then leverage their knowledge of the U.S. healthcare delivery system to identify potential pathways for care, explain the implications of different system choices, and facilitate a dialogue between the patient and providers. This process requires continuous learning about healthcare system changes and a commitment to ethical interpretation principles. Question 12. The performance metrics show a consistent pattern of interpreters accurately conveying patient statements during emergency medical services encounters. However, a recent incident involved a patient who appeared disoriented, repeatedly refusing a life-saving intervention. The patient, speaking through the interpreter, stated, "No, I don't want it. Leave me alone." The medical team is concerned about the patient's capacity to make this decision due to their apparent confusion. What is the most appropriate action for the certified medical interpreter in this critical moment? Option A. Inform the medical team that the patient has refused the intervention and relay the patient's stated reason for refusal, while also asking the medical team for guidance on how to proceed regarding the patient's capacity assessment. Option B. Immediately cease interpreting and leave the scene, as the situation involves a complex medical decision beyond the interpreter's scope. Option C. Proceed with interpreting the patient's refusal as stated, without further comment or inquiry, assuming the medical team will handle the capacity assessment. Option D. Gently persuade the patient to accept the intervention, explaining the life-saving benefits, as the patient appears disoriented and unable to make a sound decision. The correct answer is A. Inform the medical team that the patient has refused the intervention and relay the patient's stated reason for refusal, while also asking the medical team for guidance on how to proceed regarding the patient's capacity assessment. Explanation. This scenario presents a significant professional challenge due to the inherent conflict between patient autonomy, the urgency of a medical emergency, and the interpreter's ethical obligation to provide accurate and impartial communication. The interpreter must navigate a situation where a patient's immediate safety is paramount, but their expressed wishes, even if potentially influenced by their condition, cannot be disregarded without careful consideration and adherence to established protocols. The interpreter's role is not to make medical decisions, but to facilitate clear understanding and ensure the patient's voice is heard within the emergency response framework. The correct approach prioritizes patient-centered care and upholds the interpreter's ethical mandate. By seeking clarification from the medical team regarding the patient's capacity to refuse treatment and ensuring the patient understands the potential consequences of their decision, the interpreter acts as a bridge of accurate information. This aligns with the CMI's ethical code, which emphasizes impartiality, accuracy, confidentiality, and professional competence. Specifically, it upholds the principle of facilitating communication that respects patient autonomy, while ensuring the medical team has the necessary information to assess capacity and provide appropriate care within legal and ethical boundaries. The interpreter's action of informing the medical team about the patient's refusal and the patient's stated reasons, while also seeking guidance on capacity assessment, is crucial for informed decision-making by the healthcare providers. An incorrect approach that involves overriding the patient's stated refusal, even with good intentions, violates the principle of patient autonomy and the interpreter's role as a neutral conduit. The interpreter is not authorized to make judgments about the patient's capacity or the validity of their refusal. Similarly, an approach that involves simply relaying the refusal without seeking clarification on capacity or informing the medical team of the patient's stated reasons fails to fully support the medical team's assessment and the patient's right to have their wishes understood. This could lead to a situation where the medical team proceeds without a complete understanding of the patient's expressed desires and the potential underlying reasons, which could have ethical and legal ramifications. Another incorrect approach, such as leaving the situation without attempting to facilitate communication or seek guidance, constitutes a failure to provide essential interpreting services in an emergency, potentially jeopardizing patient care and violating professional responsibilities. The professional decision-making process in such situations requires a systematic approach. First, accurately interpret the patient's statements. Second, identify potential ethical or communication barriers, e.g., language, perceived coercion, patient's condition affecting decision-making. Third, communicate the patient's statements and concerns clearly to the medical team. Fourth, seek clarification from the medical team regarding protocols for assessing patient capacity and handling refusals in emergency situations. Fifth, facilitate further communication between the patient and the medical team as directed, ensuring both parties understand each other. The interpreter must remain impartial and avoid imposing their own judgments or values. Question 13. Investigation of a situation where a physician is explaining a complex surgical procedure to a patient who speaks limited English. The patient's adult child is present and appears to be translating some information to the patient, but the physician is concerned the patient does not fully grasp the risks. The interpreter is present. What is the interpreter's primary responsibility in this scenario to uphold informed consent and patient rights? Option A. Ensure the patient fully understands the risks, benefits, and alternatives of the procedure by interpreting all information directly and accurately, and if comprehension is lacking, inform the physician and facilitate further explanation or clarification. Option B. Rely on the adult child to convey the essential information to the patient, as they are family and likely understand the patient's needs and cultural context better than the interpreter. Option C. Interpret the physician's explanation verbatim without assessing the patient's comprehension, as the interpreter's role is strictly linguistic and not to evaluate understanding. Option D. Prioritize the physician's need to proceed with the surgery due to time constraints, interpreting only the key points of the procedure and assuming the patient will ask questions if they have concerns. Correct answer is A. Ensure the patient fully understands the risks, benefits, and alternatives of the procedure by interpreting all information directly and accurately. And if comprehension is lacking, inform the physician and facilitate further explanation or clarification. Explanation. This scenario is professionally challenging because it requires the interpreter to navigate a complex situation involving patient autonomy, potential cultural misunderstandings, and the legal mandate of informed consent. The interpreter's role is not merely linguistic, but also ethical and legal, ensuring the patient fully comprehends their treatment options and risks and can make a voluntary decision. The interpreter must balance the urgency of the medical situation with the patient's right to understand and consent. The correct approach represents best professional practice because it prioritizes the patient's right to informed consent as mandated by U.S. federal regulations, such as those stemming from the Patient Self-Determination Act and the Affordable Care Act's provisions on patient rights, as well as ethical codes of conduct for medical interpreters. This approach ensures the interpreter facilitates a clear and accurate communication of medical information, including risks, benefits, and alternatives, allowing the patient to make an autonomous decision. The interpreter's commitment to impartiality and accuracy is paramount in upholding these rights. An incorrect approach that involves the interpreter making assumptions about the patient's understanding based on their demeanor or family's input is a significant ethical and regulatory failure. This violates the principle of patient autonomy and the interpreter's duty to ensure comprehension. It bypasses the legal requirement for informed consent, potentially leading to a patient agreeing to a procedure without full understanding, which is a violation of their rights and could have legal ramifications for the healthcare provider. Another incorrect approach, where the interpreter prioritizes the physician's perceived urgency over the patient's need for comprehension, is also a failure. While medical urgency is a factor, it does not negate the fundamental right to informed consent. The interpreter's role is to facilitate understanding, not to expedite the process by compromising the quality of information conveyed or the patient's opportunity to process it. This can lead to a situation where consent is obtained under duress or without true understanding, which is ethically and legally unsound. The professional decision-making process for similar situations should involve a clear understanding of the interpreter's role as a conduit for information and a facilitator of communication, not a decision-maker or an advocate for either party. The interpreter must assess the patient's comprehension, identify potential barriers, linguistic, cultural, or cognitive, and communicate these to the healthcare provider. If comprehension is lacking, the interpreter must advocate for additional time or resources to ensure understanding before consent is given, always adhering to the ethical code and relevant regulations. Question 14. What factors determine the optimal note-taking strategy for a certified medical interpreter, CMI, during a patient-provider encounter to ensure accuracy and facilitate communication? Option A. The interpreters focus on recording only numerical data and dates. Option B. The interpreter's ability to capture key medical terms, concepts, and critical patient information while maintaining the flow of communication. Option C. The interpreter's capacity to transcribe verbatim every word spoken by the patient and provider. Option D. The interpreter's reliance on their memory alone without any form of note-taking. The correct answer is B. The interpreter's ability to capture key medical terms, concepts, and critical patient information while maintaining the flow of communication. Explanation. This scenario is professionally challenging because medical interpreters must balance the need for accurate and comprehensive note-taking with the primary duty of facilitating clear and immediate communication. Overly detailed note-taking can disrupt the flow of the interpretation, leading to delays and potential misunderstandings. Conversely, insufficient notes can compromise accuracy and the ability to recall critical information later, which is vital for patient safety and continuity of care. The interpreter's judgment is crucial in determining the optimal level of detail and the most efficient note-taking strategy. The correct approach represents best professional practice because it prioritizes the interpreter's cognitive load and the dynamic nature of medical encounters. By focusing on key terms, concepts, and critical information, the interpreter can maintain accurate recall without sacrificing the immediacy and flow of communication. This strategy aligns with ethical principles of accuracy and impartiality, ensuring that the patient and provider receive a faithful rendition of the exchange. It also implicitly supports the interpreter's ability to manage their workload effectively, preventing burnout and maintaining high-performance standards. This approach is indirectly supported by professional standards that emphasize the interpreter's role in facilitating communication, which requires both immediate rendering and the ability to recall essential details. An incorrect approach that involves verbatim transcription of every word spoken is professionally unacceptable. This strategy fails to acknowledge the cognitive limitations of human memory and the practical constraints of real-time interpretation. It would lead to significant delays, disrupt the natural flow of conversation, and likely result in a breakdown of communication. Ethically, this approach compromises the interpreter's ability to be impartial and accurate, as the focus shifts from conveying meaning to the arduous task of recording. It also fails to meet the implicit expectation of facilitating a smooth and efficient interaction. Another incorrect approach, relying solely on memory without any form of note-taking, is also professionally unacceptable. While some interpreters may have excellent recall, this method is inherently unreliable, especially in complex medical situations involving technical terminology, multiple speakers, or lengthy exchanges. It poses a significant risk to patient safety and the accuracy of the interpretation. Ethically, it violates the principle of accuracy by introducing a high probability of omissions or misremembered details. It also fails to provide any verifiable record of the interpreted exchange, which can be crucial for accountability and review. A third incorrect approach, focusing only on numbers and dates without capturing critical medical concepts or patient statements, is also professionally unacceptable. While numerical data is important, medical interpretation requires capturing the full context of the patient's condition, symptoms, and treatment plans. Omitting key medical information would lead to an incomplete and potentially misleading interpretation. Ethically, this approach compromises accuracy and impartiality by selectively recording information, thereby failing to convey the entirety of the message. The professional decision-making process for similar situations involves a continuous assessment of the communication context. Interpreters should consider the complexity of the language, the technicality of the subject matter, the pace of the conversation, and the specific needs of the patient and provider. They should employ a strategy that allows for efficient capture of critical information, such as keywords, concepts, dosages, and patient-reported symptoms, while maintaining the flow of interpretation. This often involves developing personal shorthand or mnemonic devices. Regular professional development in note-taking techniques and practice in simulated environments are essential for honing these skills. Question 15. When evaluating a patient's reluctance to undergo a recommended medical procedure due to deeply held traditional healing practices, which approach best facilitates informed consent and respects patient autonomy within the U.S. regulatory framework for medical interpreters? Option A. Advise the patient that their beliefs are a barrier to receiving adequate medical care and suggest they reconsider their commitment to these practices. Option B. Politely but firmly explain to the patient that their traditional practices are not scientifically proven and will likely interfere with the effectiveness of the medical treatment. Option C. Focus solely on explaining the medical procedure in detail, assuming the patient will integrate this information with their existing beliefs without further clarification. Option D. Facilitate a dialogue where the patient explains their traditional practices, and the interpreter clarifies how these practices might interact with or be affected by the proposed medical intervention, ensuring the healthcare provider understands the patient's perspective. The correct answer is D. Facilitate a dialogue where the patient explains their traditional practices, and the interpreter clarifies how these practices might interact with or be affected by the proposed medical intervention, ensuring the healthcare provider understands the patient's perspective. Explanation. This scenario presents a professional challenge because the medical interpreter must navigate a situation where a patient's deeply held health beliefs and practices may conflict with recommended medical treatment. The interpreter's role is not to judge or override these beliefs, but to facilitate accurate communication and understanding between the patient and the healthcare provider, ensuring informed consent and patient autonomy. The interpreter must be culturally sensitive and aware of potential communication barriers, arising from differing worldviews on health and illness. The correct approach represents best professional practice because it prioritizes patient-centered care and upholds the interpreter's ethical obligations. By actively seeking to understand the patient's beliefs and explaining how they might interact with the proposed medical intervention, the interpreter facilitates a more collaborative and respectful dialogue. This approach aligns with the core principles of medical interpreting, which include accuracy, impartiality, and cultural competence, as outlined in professional standards and ethical codes that guide certified medical interpreters. The goal is to empower the patient to make informed decisions based on a complete understanding of both their own beliefs and the medical options presented. An incorrect approach that involves dismissing or minimizing the patient's beliefs is professionally unacceptable. This demonstrates a lack of cultural humility and can lead to patient alienation, distrust, and non-adherence to treatment. Ethically, it violates the principle of respect for patient autonomy and can be seen as imposing the provider's or interpreter's own cultural framework. Another incorrect approach, such as directly advising the patient to abandon their beliefs for medical reasons, oversteps the interpreter's role. This constitutes practicing medicine or offering unsolicited advice, which is outside the scope of practice for a medical interpreter and can lead to serious ethical and legal ramifications, potentially violating guidelines that prohibit interpreters from acting as advocates in a way that compromises impartiality. Professionals should approach such situations by first acknowledging and validating the patient's perspective. They should then use their linguistic and cultural skills to bridge the gap, clarifying medical information in a culturally appropriate manner and ensuring the patient's beliefs are understood by the healthcare team. The decision-making process involves a continuous assessment of the communication dynamics, a commitment to neutrality, and a focus on facilitating informed consent while respecting the patient's right to make decisions aligned with their values and beliefs. Question 16. The assessment process reveals that a patient is being discharged with a complex medication regimen and specific wound care instructions. The interpreter has relayed all information from the physician. When asked if they understand, the patient nods and says, "Yes, I understand." What is the most appropriate next step for the interpreter to ensure effective discharge planning and follow-up care? Option A. Offer to simplify the language of the instruction, assuming the patient may have found the medical terminology difficult. Option B. Proceed with the discharge, trusting the patient's verbal affirmation of understanding. Option C. Ask the patient to explain the medication schedule and wound care steps in their own words to confirm understanding. Option D. Ask the patient if they have any questions, and if they say no, consider the communication complete. The correct answer is C. Ask the patient to explain the medication schedule and wound care steps in their own words to confirm understanding. Explanation. The assessment process reveals a critical juncture in patient care, discharge planning. This scenario is professionally challenging because effective discharge planning and follow-up care are paramount to ensuring patient safety, continuity of care, and preventing readmissions. Misinterpreting or failing to adequately address the patient's understanding of their post-discharge instructions can lead to adverse health outcomes, non-adherence to treatment plans, and increased healthcare costs. The interpreter's role here is not merely linguistic, but also cultural and educational, ensuring the patient comprehends complex medical information and feels empowered to manage their health independently. The correct approach represents best professional practice because it prioritizes patient comprehension and autonomy, aligning with the core ethical principles of beneficence and respect for persons. By actively verifying the patient's understanding through teachback and addressing any identified gaps, the interpreter ensures the patient can safely and effectively manage their care at home. This proactive engagement is crucial for successful discharge and aligns with regulatory expectations for patient education and informed consent, which implicitly require comprehension. Each incorrect approach represents specific regulatory or ethical failures. Failing to confirm understanding and proceeding with the assumption of comprehension violates the principle of beneficence by potentially exposing the patient to harm due to misunderstanding. This also undermines the patient's right to make informed decisions about their health, a cornerstone of ethical medical practice and often a regulatory requirement. Offering to simplify the instructions without verifying the patient's current level of understanding risks oversimplification or misinterpretation, potentially omitting crucial details. This can lead to a false sense of security for both the patient and the healthcare team, failing to meet the standard of care for effective patient education. Relying solely on the patient's verbal affirmation of understanding without employing a method to assess actual comprehension is a common pitfall that can lead to significant gaps in knowledge, thereby failing to uphold the interpreter's duty to facilitate accurate communication and understanding. The professional reasoning process for similar situations should involve a multi-step approach. First, accurately and completely interpret all discharge instructions. Second, actively assess the patient's comprehension using methods like teachback, asking the patient to explain the instructions in their own words. Third, identify any areas of confusion or misunderstanding. Fourth, work collaboratively with the healthcare provider to clarify and re-explain information as needed, ensuring the patient grasps the critical aspects of their care plan. Finally, document the communication and any identified comprehension issues. This systematic approach ensures that the interpreter acts as a bridge to understanding, not just a conduit for words. Question 17. Cost-benefit analysis shows that investing in culturally competent medical interpretation significantly reduces the risk of adverse patient outcomes and improves patient satisfaction. Yet a common challenge arises when a patient's deeply ingrained cultural beliefs about illness causation and healing practices directly contradict the recommended medical treatment. In such a situation, what is the most ethically and professionally appropriate action for a certified medical interpreter, CMI? Option A. Focus solely on conveying the medical provider's instructions verbatim, without attempting to explore or explain the cultural underpinnings of the patient's resistance. Option B. Facilitate a dialogue where the interpreter helps the patient and provider explore the patient's cultural beliefs and concerns, enabling them to collaboratively find common ground or alternative approaches that respect both cultural perspectives and medical necessity. Option C. Politely inform the patient that their cultural beliefs are not scientifically valid and that they must adhere to the doctor's recommendations for their own well-being. Option D. Suggest to the healthcare provider that the patient may not be a suitable candidate for treatment due to their non-compliance with established medical protocols. The correct answer is B. Facilitate a dialogue where the interpreter helps the patient and provider explore the patient's cultural beliefs and concerns, enabling them to collaboratively find common ground or alternative approaches that respect both cultural perspectives and medical necessity. Explanation. This scenario is professionally challenging because it requires the medical interpreter to navigate a situation where a patient's deeply held cultural beliefs about health and illness directly conflict with recommended medical treatment. The interpreter's role is not to judge or impose their own understanding, but to facilitate accurate and effective communication between the patient and the healthcare provider. Misinterpreting or failing to convey the nuances of the patient's cultural perspective could lead to a breakdown in trust, non-adherence to treatment, and potentially negative health outcomes, all of which have significant ethical and professional implications. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent, core tenets of medical ethics and interpreter professional standards. By actively seeking to understand and convey the patient's cultural framework, the interpreter enables the healthcare provider to address the patient's concerns more effectively and collaboratively develop a treatment plan that respects the patient's beliefs while still aiming for optimal health outcomes. This aligns with the CMI's ethical code, which mandates impartiality, accuracy, and cultural competence. The interpreter acts as a bridge, ensuring that both parties have a shared understanding, even when cultural perspectives differ. An incorrect approach that involves dismissing or minimizing the patient's cultural beliefs is a significant ethical failure. It violates the principle of respect for persons and can be perceived as culturally insensitive or discriminatory. This can lead to the patient feeling unheard, disrespected, and less likely to trust the medical team, thereby compromising their care. Furthermore, failing to accurately convey the patient's concerns to the provider, even if they seem culturally unusual, is a breach of accuracy and can lead to misdiagnosis or inappropriate treatment. Another incorrect approach, such as attempting to educate the patient on Western medical practices without first understanding their existing beliefs, oversteps the interpreter's role and can be seen as an imposition of values, undermining the collaborative nature of healthcare. The professional decision-making process for similar situations involves a multi-step approach. First, actively listen to and acknowledge the patient's statements and concerns. recognizing their cultural context. Second, use clarifying questions to ensure a thorough understanding of the patient's perspective and its underlying cultural significance. Third, accurately and impartially convey this understanding to the healthcare provider, highlighting any potential cultural barriers to treatment. Fourth, facilitate a dialogue between the patient and provider where both perspectives can be discussed openly and respectfully. Finally, support the development of a mutually agreeable plan that respects the patient's autonomy and cultural values while adhering to medical best practices. Question 18. Process analysis reveals that a certified medical interpreter, CMI, is scheduled to interpret for a patient they know personally from their community. The interpreter has a friendly but not intimate relationship with the patient. The interpreter is concerned about how this personal connection might affect their ability to remain completely neutral and accurate during the medical consultation. What is the most appropriate course of action for the interpreter in this situation? Option A. Inform the healthcare provider of the acquaintance but proceed with the interpretation, assuring them of their professionalism. Option B. Disclose the personal relationship to the healthcare provider and request to be reassigned to a different patient or have another interpreter assigned to this patient. Option C. Interpret the session, but inform the patient privately afterward about the potential for unconscious bias due to the acquaintance. Option D. Proceed with the interpretation, making a conscious effort to remain neutral and objective, as the relationship is not intimate. The correct answer is B. Disclose the personal relationship to the healthcare provider and request to be reassigned to a different patient or have another interpreter assigned to this patient. Explanation. This scenario presents a common yet complex conflict of interest challenge in medical interpreting, specifically when an interpreter has a pre-existing personal relationship with a patient. The professional challenge lies in balancing the interpreter's duty to provide impartial and accurate interpretation with the potential for bias, perceived or actual, stemming from the personal connection. Maintaining patient confidentiality and ensuring the integrity of the medical encounter are paramount. The Certified Medical Interpreter, CMI, credential signifies a commitment to upholding the highest ethical and professional standards, which include rigorous conflict of interest protocols. The correct approach prioritizes patient well-being and the integrity of the medical process by recognizing the inherent conflict and taking proactive steps to mitigate it. This aligns with best professional practice as outlined by interpreter certification bodies and ethical codes, which mandate impartiality and the avoidance of situations that could compromise professional judgment. By disclosing the relationship and facilitating a transfer to another interpreter, the interpreter upholds their ethical obligation to avoid conflicts of interest and ensures the patient receives unbiased communication. This action directly addresses the potential for compromised objectivity and protects the patient's right to receive care based on accurate and unadulterated information. An incorrect approach that involves proceeding with the interpretation despite the personal relationship, fails to acknowledge the potential for bias. This could lead to unintentional omissions, subtle alterations in meaning, or a perceived lack of neutrality by the patient or healthcare provider, thereby violating the core ethical principle of impartiality. Another incorrect approach, such as attempting to interpret while consciously trying to remain neutral without disclosure, is also problematic. While the intention might be good, the inherent emotional or personal investment can unconsciously influence the interpretation, and the lack of transparency erodes trust. Furthermore, failing to disclose the conflict to the healthcare provider or supervisor leaves the decision-making power in the hands of individuals unaware of the potential bias, which is a breach of professional responsibility. These approaches are ethically unsound because they disregard the fundamental requirement for interpreters to be objective conduits of information and to proactively manage any situation that could compromise that objectivity. The professional decision-making process in such situation should involve a clear, immediate assessment of any potential conflicts of interest. Upon recognizing a personal relationship with a patient, the interpreter must immediately consider the implications for impartiality. The next step is to disclose the conflict to the appropriate authority, typically the healthcare provider or the interpreting agency supervisor. This disclosure should be followed by a recommendation to be reassigned to a different patient or to have a different interpreter assigned to the current patient. This proactive and transparent approach ensures that patient care is not compromised and that the interpreter maintains their professional integrity. Question 19. System analysis indicates that during a simultaneous interpretation of a patient-provider consultation, the interpreter encounters a complex medical term they are not entirely familiar with. The provider continues speaking at a steady pace. Which of the following represents the most professionally sound approach to maintain accurate and effective communication? Option A. Pause briefly to recall or look up the exact term, potentially causing a noticeable gap in the interpretation. Option B. Use the closest accurate equivalent term in the target language, even if it is slightly more general, and continue interpreting without significant interruption. Option C. Guess at the meaning of the term and provide an interpretation based on that guess. Option D. Omit the term entirely to avoid potential misinterpretation and maintain a smoother flow. The correct answer is A. Pause briefly to recall or look up the exact term, potentially causing a noticeable gap in the interpretation. Explanation. Scenario analysis. This scenario presents a common challenge in simultaneous interpreting, where the interpreter must manage the cognitive load of listening, processing, translating, and speaking concurrently, while also ensuring accuracy and fidelity to the source message. The pressure of a live medical consultation, where patient well-being is paramount, amplifies the need for precise and timely interpretation. The interpreter must also navigate potential cultural nuances and the emotional state of the patient and provider. Correct approach analysis. The correct approach demonstrates a commitment to professional standards by prioritizing the integrity of the message and the patient's understanding. This involves maintaining a consistent pace, using appropriate terminology, and employing techniques to manage omissions or minor errors gracefully. The ability to self-correct without disrupting the flow or causing confusion is a hallmark of skilled simultaneous interpreting. This aligns with the CMI's ethical obligations to provide accurate and complete interpretation, ensuring informed consent and effective communication in healthcare settings, as mandated by general ethical codes for medical interpreters, which emphasize accuracy, impartiality, and confidentiality. Incorrect approaches analysis. One incorrect approach involves pausing for extended periods to ensure perfect recall of every word. This disrupts the natural flow of the consultation, can lead to information gaps for the patient, and creates an unprofessional impression. It fails to meet the expectation of continuous interpretation inherent in simultaneous mode and can impede the therapeutic relationship. Another incorrect approach is to paraphrase extensively or omit details to simplify the message. While simplification might seem helpful, it risks misrepresenting the provider's intent or the patient's condition, potentially leading to misdiagnosis or inappropriate treatment. This violates the ethical duty of fidelity and accuracy, which is a cornerstone of medical interpreting. A third incorrect approach is to guess at terminology when unsure, rather than using a more general but accurate term or seeking clarification. This can introduce significant errors, especially in a medical context where precise terminology is critical for understanding and treatment. It undermines patient safety and the interpreter's professional credibility. Professional reasoning. Professionals should employ a decision-making process that prioritizes accuracy, fidelity, and the smooth flow of communication. This involves continuous self-monitoring, strategic use of memory aids, if permissible and practiced, and a proactive approach to managing challenges. When faced with a difficult term or phrase, the best practice is to use the closest accurate equivalent. Note the term for potential clarification later if necessary, or briefly signal the need for repetition without significant interruption. The goal is to convey the meaning as faithfully as possible within the constraints of simultaneous interpretation, always keeping the patient's comprehension and safety as the primary concern. Question 20. Risk assessment procedures indicate that a certified medical interpreter, CMI, is interpreting a conversation between a physician and a patient. During the session, the patient discloses information that strongly suggests ongoing child abuse within their household. The CMI is aware of their ethical obligations to maintain patient confidentiality, but also understands that certain disclosures may trigger mandatory reporting requirements under U.S. federal and state laws. What is the most appropriate course of action for the CMI in this situation? Option A. Discuss the situation with a trusted colleague or supervisor to get their opinion on how to proceed before taking any action. Option B. Continue interpreting without intervening or reporting, assuming the physician will address the issue if they deem it necessary. Option C. Immediately report the disclosed information to the appropriate authorities or the designated healthcare professional responsible for reporting, as per mandated reporting laws. Option D. Advise the patient on how to protect their child and suggest resources for help, while maintaining confidentiality until the patient decides to report. The correct answer is C. Immediately report the disclosed information to the appropriate authorities or the designated healthcare professional responsible for reporting, as per mandated reporting laws. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified medical interpreter, CMI, due to the inherent conflict between patient confidentiality and mandatory reporting requirements. The interpreter is privy to sensitive information that, if not handled correctly, could lead to legal repercussions for the interpreter and harm to the patient or others. The interpreter must navigate this delicate balance, understanding their legal obligations while upholding ethical principles. Correct approach analysis. The correct approach involves immediately reporting the disclosed information to the appropriate authorities as mandated by law. In the United States, federal and state laws, such as the Child Abuse Prevention and Treatment Act, CAPTA, and various state-specific child abuse reporting statutes, require certain professionals, including those in healthcare settings who may interact with interpreters, to report suspected child abuse or neglect. While interpreters are not always explicitly named as mandated reporters, the information they interpret can trigger reporting obligations for the healthcare provider. The CMI's role is to facilitate communication, and in this instance, that includes ensuring legally required information reaches the designated authorities. This aligns with the CMI's responsibility to act ethically and legally, prioritizing the safety and well-being of vulnerable individuals as dictated by U.S. regulations. Incorrect approach is analysis. Failing to report the information or delaying the report constitutes a significant regulatory and ethical failure. This inaction could be interpreted as a violation of mandated reporting laws, potentially leading to legal penalties for the interpreter and the healthcare facility. Ethically, it breaches the duty to protect vulnerable individuals, especially children, from harm. Attempting to counsel the patient or directly intervene without involving appropriate authorities is also a failure. While well-intentioned, it oversteps the interpreter's professional boundaries and legal responsibilities. Interpreters are not trained counselors or social workers, and their role is to facilitate communication, not to provide direct services or make independent judgments about intervention beyond reporting. This approach bypasses the established legal and professional protocols for handling such sensitive situations. Discussing the situation with colleagues or supervisors without immediately initiating the reporting process is another failure. While seeking guidance can be beneficial, it should not supersede the immediate legal obligation to report suspected abuse or neglect. This delay can be critical in protecting a child. Furthermore, discussing confidential patient information outside of the mandated reporting channels can also raise privacy concerns. Professional reasoning. When faced with information that suggests potential harm to a vulnerable individual, particularly a child, the professional decision-making process for a CMI should prioritize immediate action aligned with legal mandates. This involves 1. Identifying the nature of the disclosed information and assessing if it falls under mandated reporting categories, e.g., suspected child abuse, elder abuse, imminent danger. 2. Recalling and applying knowledge of relevant U.S. federal and state laws regarding mandated reporting. 3. Immediately notifying the designated healthcare professional, e.g., physician, nurse, social worker, who is legally responsible for making the official report, or reporting directly to the appropriate authorities if that is the established protocol or legal requirement for the interpreter's role. 4. Documenting the incident and the actions taken. 5. Seeking clarification or support from professional organizations or supervisors if unsure about specific reporting procedures, but without delaying the initial report.